Hi, this is Ken Johnson. I'm senior demographer at the Carsey School of Public Policy and also a professor of sociology at the University of New Hampshire. And I'd like to talk to you today about my recent research on the coronavirus in rural America. Rural America has about 46 million people in it. It includes about 72% of the land area of the United States. Now, to date, most of the corona cases have been in urban areas, almost 95% of them. But what I want to look at today here is what the risks are to rural America. Rural America has some unique characteristics that make it more likely that the death rates from the coronavirus, should they reach rural areas, will be higher. Some of the factors that affect the coronavirus that we know about so far, and of course research is ongoing on this, is chronic health conditions increases the likelihood of it, food insecurity, racial and ethnic diversity appears to be a factor, inequality appears to be a factor, and of course, access to medical care. But one of the factors that's carried the biggest weight, and this is in a variety of studies in a variety of countries, is age. And so today, what I'm going to focus on here is the impact that the age structure of rural America has on the likelihood of mortality, of death, if someone is infected. So in other words, I'm looking only at situations where there's been an infection, and I'm asking, what are the mortality rates likely to look like in urban and rural America for that? Age is a huge factor in the likelihood of serious health problems from the coronavirus or death. The rural population is considerably older than the American population as a whole, or than the metropolitan population. About 26% of the people who live in non-metropolitan or rural America are over the age of 60, compared to about 21% of the US population in metropolitan areas. So because the rural population is older, the risk that it will suffer mortality if it's exposed to the virus are greater. Now, that's fairly widely known, but I'd like to give you a more clear idea of exactly how this plays out in rural America. So again, I emphasize there are many other factors that will influence mortality rates from the coronavirus. The age structure is an important one. I'm focusing my research on here and on the age structure, and I'm focusing also on what happens to people who contract the virus. If the virus is more widespread in some areas, like it is in New York City, then the death rates would be higher for other reasons. In much of rural America, there has not been many instances of the virus yet. So even though the mortality rates may be higher in rural America, there are fewer cases of it. But given that background, let's talk about a little bit about that and take a look particularly at a map which will show you rural America and urban America. So this map shows the expected mortality rates in rural and urban America given the incidence of the virus. Now, in other words, if the virus appears in a county, these are counties, what's the likelihood of mortality? And the metropolitan or urban counties are outlined in black. All the areas that aren't outlined in black are rural or non-metropolitan counties. And you can see clearly on this graphic that rural counties have higher potential death rates than urban counties in much of the United States. Now, again, I emphasize this is once there is an incidence of the disease. So if a rural county doesn't have very much of the disease, the likely number of deaths will be lower. But because its age structure is considerably older, and that's an important factor in the disease and in the likely mortality from the virus, rural America has greater risks. 55% of the rural counties have potential death rates if the virus is contracted, which are well above the national average. In contrast, the bluer and greener counties are places where the death rates based on age would be lower. Now that doesn't mean that if Houston gets a lot of cases that they won't have a lot of deaths. It just means that the age structure of the metropolitan area may diminish the number of deaths compared to what would happen if the same number of cases occurred in a rural area. So you can see there are areas with high concentrations of quite high death rates in the Great Plains, the upper Great Lakes, down the Appalachian Mountains, and in parts of the West. This is because those populations, the rural populations in those counties are considerably older. Just to give you an idea of this, here's the estimated death rates based on age in different parts of the United States compared to the overall US death rate. So you can see the blue counties are the counties that are metropolitan. Many more of them have death rates that would be estimated to be lower based on age because their populations are younger. In contrast, in the areas where the likely death rate is 40% above the national average, you can see most of those counties are rural. Now, again, I emphasize to you, there are fewer people in those rural counties, but because their age structure is so high, they're likely to experience higher death rates if the virus gets to them. So these are the differences in risk by different areas. 41%, for example, of the urban counties are below the national average. In comparison, only about 14% of the non-metropolitan counties are. So you can see that there are quite substantial differences in age distributions across these rural and urban areas. Now, fortunately, to date, rural America has had a lower incidence of the coronavirus than urban areas. This is the percentage of counties that have been exposed to the coronavirus, that have had cases of it over the given time period. So you can see most urban areas have had coronavirus cases in them for more than 14 days. In contrast, the rural counties are less likely to have had cases for that long. And they're more likely to have started to have the disease occurring more recently. And in some cases, about 25% or 29% in this graphic of the counties, rural counties, they actually have not had any instances of the disease yet. But that's changing rapidly. Just since this data was analyzed on Friday, 5% more of the rural counties have started to have their first case of the coronavirus. So it is spreading into rural America. So that's a major cause for concern. Now, again, most of the coronavirus cases have occurred in urban areas, but the incidence of it is growing in rural parts of the United States. So that's an important point to recognize about all of this that's going on. Here's a map that illustrates to you where the rural and urban incidences of the diseases started and how long they've been around. So you can see that the red areas are the ones where the disease has been around the longest, and many of them are urban. The oranges and blues are places where the diseases started to occur more recently. Many more of them are rural. And then the gray areas are places which, as of Friday, had yet to experience any cases of the disease, any reported cases of the disease. And so those are areas which have yet to receive any cases. Now, again, if you recall the earlier map, many of those gray areas are areas where the likely mortality rates based on age would have been higher. So if the disease spreads into those areas, the risks to the individuals will be higher. So, as I emphasized to you before, age is important, but it's not the only factor that affects mortality from the disease. Rural areas also have higher incidences of chronic health problems like heart and lung disease and diabetes. Those all raise risks. They have higher obesity rates, which also raise risks. There's greater food insecurity, so there are people who have more trouble getting good food. Again, another risk factor. And then, of course, a huge risk factor in rural areas is healthcare. Rural areas have much lower levels of healthcare than urban areas. They have fewer doctors, fewer healthcare workers, fewer hospitals. The hospitals are not as comprehensive, and many of them have closed in recent periods. So all of those things suggest that should this disease reach rural areas and that there be large incidences of the disease, the risks to rural America are going to be high. Now, again, in rural areas, if the disease gets serious and you need comprehensive health care in a major medical center, they're far away. Over 50% of the counties in the United States don't have a single ICU unit. Almost all of them are rural counties. And one of the things that's protect rural America so far, the lower population density and the fact that the population is more spread out, is really a double-edged sword, because while it may reduce the incidence of the disease, if one contracts the disease, it's a long way to medical care. Rural America has about 14% of the population, but it takes up 72% of the land area. So the population is spread over a very broad region. Whether they have access to high quality comprehensive health care and major medical centers with ICUs and infectious disease doctors is questionable. So there's no question that the substantial majority of all the corona cases will occur in urban America. It contains 86% of the population. So far, about 95% of the cases and the deaths have been in urban areas. But again, the disease is spreading into rural America. Even a modest number of deaths in small rural counties can have a significant impact on the population. So rural America faces unique demographic, institutional, and social problems in trying to address the needs of the disease. If anything, if the virus disrupts the supply chains and the infrastructure of rural America, it has implications for the whole country, because rural America produces virtually all of the food and raw materials for the country. And so anything that disrupts the supply chains could have significant implications. So the solutions to the problems of how to deal with the coronavirus have to take into account rural America as well as urban America. Thank you very much.